Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello, and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel. Do you have a self-care protocol with acupuncture for some sort of pain or injury prevention? Do you have a sense of how you can best treat your own low back pain, being that it's very difficult to reach a lot of the low back muscles by ourselves? I want to share my protocol that keeps me out of low back pain. And if you're like me and you're not always conscious of how you're standing while working on your patients, and if you're tall like I am, then you spend more time bent over a table than you probably should or would like to. And this can lead to low back pain if you're not taking care of yourself. So I wanted to share my protocol with point locations. I talk a lot about motor points on the podcast, but I don't usually share very specific point locations. Part of that has to do with me trying to be responsible and not encouraging non-acupuncturists to try to use acupuncture. But I do believe that the protocol I'm about to share, if you, even for a novice, I will not be sharing anything that I would consider at all dangerous. So I feel comfortable sharing my protocol. Now, I used to have a lot of back problems. I used to have sciatica and a lot of back pain, and in spite of being physically fit at the time, I would hurt my back just by doing simple things like reaching to turn on the bathtub water. Bending forward while in rotation would take me out for a week or two because my back would suddenly just cramp and seize. So, and I don't deal with that anymore, thank goodness. And I believe it's because I take care of the muscles I'm about to tell you. And I wish I could tell you that I needle my own psoas, but I've not yet gained the courage to attempt that because of the position. It's kind of weird. But here's my protocol for back pain. It's 4 needles. And I think it's best if you have a 75 millimeter 30 gauge needle for this. One, the super thin needles are a lot harder to insert on yourself. You want a strong needle because you're really reaching around in the back and the glute area with these needles. So, as Vladimir Yanda would say, most musculoskeletal issues start at the pelvis, and back pain definitely starts at the pelvis for many reasons that I've explained before. So my back pain prevention protocol, and by the way, while I would say this is not 100% for somebody who's already in acute back pain, I will tell you that I do think that correcting these muscles will give you a faster recovery. If you're already, for instance, having QL pain or pain in the erectors or something from the psoas, I do believe that if you still do this protocol, which is all in the glute area, that it will speed up your recovery because your body will be able to stabilize the SI joint better. And that will allow some of that hypertonicity that's giving you pain to eventually release. So here's my protocol. You have to do it in two parts because you're going to be lying on your side and you want to treat both sides eventually. If you use electric stimulation, you can do somewhere between 3 and 5 minutes with the electric stim on these 4 needles, and then take everything out and then just do the other side. That's what I do. I find I move my dogs out of the way and lie down on my side on the bed, and I put 4 needles in. I hook them up to electric stim. I let them go 3 to 5 minutes, take them out, and do the other side. So this is what you do. You're going to treat your TFL, your tensor fasciae latae. You're going to treat your gluteus minimus, its helper. You're going to treat your gluteus medius, and you're going to treat your piriformis. I'll tell you the point locations, and then I'll tell you why I believe that those 4 points keep me out of low back pain. So the TFL motor point, you find your ASIS, and you find your greater trochanter, and you bisect it. And it should just be a little spongy muscle right on the side. And you're going to put your needle in probably a couple centimeters. Some people will have a motor point response within the first centimeter, but many of us won't. So I think the larger the body, the deeper you're going to go for these points. Use a 75 so you have room, but you're absolutely not going to use more than half of that needle. But you might need 2 centimeters, maybe 3, depends. If you go too deep, you're going to get into the sartorius. There's nothing wrong with that, but just know that if you go deeper, your sartorius is going to be kicking also. So then your gluteus minimus motor point, you find the top of the greater trochanter. You find the iliac crest, and you bisect it. You just make sure you're right behind the side of the pelvis. When you push in, you should be able to feel where the bone is, and you're going to go behind that. And this is where you absolutely do need a longer needle. And if you're larger than me, then you might even need a bit longer. You might need like a 100 millimeter needle. Not that you're going to go that deep, but if 7.5 centimeters isn't quite getting you to where you could tap the bone, then you probably need a little bit longer needle. You're going to insert that needle perpendicularly. You're on your side, and you're going to go slowly. The first thing you're going to feel is very likely going to be the gluteus medius, and you're going to feel it grab. And you're not there yet, and you're going to keep going, and then you're going to hit the very dense gluteus minimus, and if you stop there, you're not getting into the minimus. So you're going to feel where you think you tap the bone, and you're just going to push a little harder and make sure that you are at the bone. If you push a little harder and you feel an achy soreness, you're in the gluteus minimus, and you should keep going a little bit. Try to tap the bone and then pull back a little bit. That's probably the more complicated of all of them. Now, gluteus medius is the technical location. You find your PSIS, you find your greater trochanter, you go to the upper 1/3 of that diagonal line, and you put your needle in. Now, when you're on your side and your proprioception is not great, rely on palpation. Feel for the taut band in the upper third of the gluteus medius. Just find that tight band and put a needle in it. And you're probably going to go a couple centimeters just to get in. And then for the piriformis, it's very simple. You're finding the sacrum, the edge of the sacrum, the greater trochanter, go halfway. Now, you can strum cross fiber just to feel the taut band of the piriformis. And you want to put that needle in about 2 centimeters as well. You're going through glute max before you're going to get to the piriformis. So it might feel more superficial than it really is. So make sure you get into that piriformis. You should feel a little bit of a little twitch in the muscle when you get into it. Okay. Then you're going to hook up your electric stim. One hertz, 2 hertz, whatever you like. You can go faster than that. If you only have a pointer device, just stimulate each point until you feel like it's loosened up. So that could take a minute. But you don't have to overdo it. That's the amazing thing. A lot of times, 30 seconds to a minute on a muscle can do a lot of good. So why does this protocol help for low back pain? So the TFL and the gluteus minimus and the gluteus medius are abductors and pelvic stabilizers. So from the lateral stabilization subsystem or sling, we know that the abductors on one side and the QL on the other side help stabilize the pelvis. So if your right abductors are getting fatigued and weak, then the pelvis wants to sag a little bit on the opposite side. Then the left QL will tighten to kind of pull the pelvis up a little bit. So when your right abductors fatigue, the left QL is going to kick in a little harder to help stabilize the pelvis. So QL is a big part of low back pain. And that's one of the reasons that these muscles will help. Another reason, the TFL and the gluteus minimus, when they're tight and short, put a slight anterior tilt on the pelvis. And you could argue that the front fibers of gluteus medius also help with that sort of internal rotation. So it could also be contributing a bit to the pelvic tilt. The gluteus medius and the piriformis are very strong stabilizers of the SI joint. And from many, many podcasts before how important the SI joint is, and that when the glute max is not firing right, those other muscles like the deep rotators and the gluteus medius have to work harder, and the hamstrings, by the way, to stabilize the SI joint. So if you keep the piriformis and the glute medius strong, that they can help stabilize the SI joint, which is going to keep the low back muscles from tightening. So I should have said that just now, but the erectors and the QL are helping to stabilize the SI joint also. So what happens if the glutes fatigue and the piriformis is tight and weak? Now the QL and the erectors are getting tighter to stabilize the SI joint, which is why I say that low back pain starts in the pelvis. Psoas, of course, but I'm not treating my own psoas. You can do some psoas stretches, but the key here are these muscles that I'm telling you. Also, do not forget how important trigger points in the gluteus medius are for low back pain, sacral pain. So it's a 2-for-1. If you keep the gluteus medius healthy, ideally it will not progress to a point of taut, irritated bands in the muscle. You heard my last episode about the progression from hypertonic to contracture and shortening to hyper irritated bands and trigger points. So if you're catching the problem in the first two stages, hypertonicity and possible contracture and shortening of these muscles, then you're going to avoid waiting too long and where you have really taut, painful bands in the muscle. So that is my go-to protocol for staying out of low back pain. And I feel comfortable ethically telling you those points, because I think even if somebody were a complete novice, the worst thing they do is stab their own sciatic nerve. And in my world of ethics, I feel like that's their fault. That's their problem. They shouldn't be doing it. But they're not gonna damage themselves. So I feel like these are like the safest muscles. I feel like these are the best muscles to learn how to insert acupuncture needles when you are a student, because there's so little wrong that you can do in these locations. It's really these are some of the safest locations for acupuncture. So, so if so for students, even this is a safe self treatment protocol. What can I say? I think I probably don't treat myself frequently enough. I would say it's probably every 2 or 3 months that it occurs to me that I'm starting to feel a little something. Usually I start to feel something in my upper glute, um, low back sort of area, like, not quite SI joint, but that iliac crest sort of symptom. So when I feel that, then I know it's time to self treat. And so it's probably every couple months, maybe every 3 months. Um, Now, if you are having low back pain, and this is the best you can do, I really do think it's worth a try. This is what I used to do when I had a lot of back problems. I couldn't reach my own QL, or even if it felt like I wished I could needle like the L5 area because of that sharp pain right in the L5 area. I This would help me, and so don't underestimate it. I think by helping to stabilize the SI joint, you're getting rid of a lot of reactive hypertonicity from other things. Um, it may even help the psoas for some reason if the SI joint's better stabilized. Also, I think the TFL becomes overactive when the psoas is short and tight. So maybe releasing the TFL gives it a little bit more strength to do just for basic things like walking, and maybe that allows the psoas some time to relax and not be hypertonic. Um, but this protocol has worked amazingly well for me, and I would highly recommend you try it for yourself for self treatment. I would also say that it's the exact same protocol that I use on pregnant women who are having SI joint and sciatic issues. The exact same protocol. So, and usually it's on one side. So it's 20 minutes with no electric stim, because you do not use electric stimulation during pregnancy. You just insert needles, try to get a little bit of a sensation, like ask for feedback. Say, I'm looking for a little bit of the muscle to grab. Let me know when you feel a little twitch. They will feel it. Then you know you're in the motor point. Then you move to the next point. Get 4 needles in perfect locations and just retain for 20 minutes, and you will make a big shift for her. The I mean, every time I've done it, it works great. No more sciatica, no more SI joint pain, and completely safe because there's no electric stimulation, and you're not near any of the sacral points that you're supposed to avoid, or not near any of the abdominal area. You're not going into the low back. It's just a great protocol during pregnancy. So give that a try. And okay, uh, hopefully you will find that effective and helpful for yourself, for your own self treatment. And have a good week. Take care.